Hey there. So I wanted to make a video for my students because I wanted to basically give them a better way of suturing so that they have fewer post-op complications. Just as a little background for me, I'm Dr. Buckle. I'm an oral surgeon. I practice in Maryland. And I guess the greatest benefit I have found from suturing is that it has taken my post-op dry socket rate from a rate of about 2% to right around 0.01%. I get very, very few dry sockets in a given year. And I do believe that all comes from my suturing technique. So I wanted to go over that and maybe give some tips and hints. As a little background, for the most part, I do regular oral surgery. So I extract thousands of teeth in a year. So to have a very low dry socket rate has always been my goal, because the better you can get at managing your extractions, the fewer issues that you have, and the more likely it is that patients will have maybe not a great experience, because not everybody loves the dentist, but at least a pretty decent experience. So anyway, I'm going to get started. And the first thing I'm going to get out is I'm going to get out some silk sutures. I never use silk in my office, but since this is not a real person, it's a little easier to show the highlighting of a black silk suture against this material. I'm going to take it out of the package, okay? And what I have set up here is I basically have a silicone mat that has some marked out areas, and I've cut out the parts that are jagged to show the regular extractions. The rest of these are basically for plastic surgery to practice on. I mean, if you can get a nice clean incision like this in the oral cavity, that's great, but I think that is probably the least of your worries. So the first thing that we're going to do is we're basically going to show how to suture a regular extraction site. So when we talk about healing inside of the mouth, and anywhere actually, you can heal by primary intention or secondary intention. Primary intention is basically what these are showing. That's where you have wounds that are reapproximated so that it goes from being something slightly open to something that is closed. And so the wound heals basically right up next to each other, almost like you are closing an envelope. When we extract teeth, teeth don't come out in a straight line. Teeth are shaped like squares, like ovals, and all sorts of shapes, but nothing that comes anywhere close to a nice flat line. So what we want to really do is to maximize how much secondary intention healing that we can get. And that really means to create a space where the clot can form and maintain itself. So when I think about this, I kind of think about it like underwater basket weaving. You are working with fluids, and you are trying to create basically a weaving kind of pattern in order to basically help yourself out a little bit. So the first thing we're going to do is we are going to get our suture onto our needle holder like this, and we're going to get our pickups. So I'm going to pretend this is an extraction site of a molar, and I'm going to show you a suture technique that I don't really see anybody else doing, and so for all intents and purposes, I'm going to call this the buckle backstitch, because why not name something after myself? So what I do is I usually come from the distal, because it is easier for me to start from the distal and end on the mesial. But you can do it however you want. But I start at the edges, the corners, basically. And what I'll do is I am doing a cross suturing technique. So I'll come from the buccal to the lingual, and I will make my first suture. And then I'm going to go across my square, because that's how I think of an extraction site. It kind of looks like a square. And I'm going to go in the mesial corner from the buccal to the lingual again. And you can see that it's already started to make an X, and that is exactly what I want. Now, this isn't where I finish though. I finish in the middle. So I'm going to create a third suture equidistant between the two of them, right in the middle. And I'm going to again go from buckle to my lingual, and that will be my final suture. Okay. So once I have done this final lingual suture, you can see how it very much looks like a weaving pattern. Once I finish and tie this off, you'll see it even better. So I'll do my first as a double throw, then I do a single throw and a single throw. I've seen people do this all sorts of ways. Double, single, 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 double, double. It doesn't really matter as long as you do at least 3 throws to get everything tied down. So once I do that, then you can see that the weaving pattern has established itself. And so from there, you know that as a clot forms, in order for the clot to actually extravasate or basically come out, it's going to have to get through multiple layers. So that is how I suture almost every single posterior tooth in the mandible. When I do the uppers, I don't always suture because I tend to find that unless patients are smokers, uppers do very, very well. So this is basically to show a more anterior tooth. Again, I do suture almost everything in the mandible, not always everything in the maxilla. But for this one, I don't do exactly the same basket weaving technique. This one is just a simple cross suture. So I will go again from the distal buckle to the distal facial, and I will just do a single cross suture. So just mesial buckle to the mesial buckle to the mesial lingual, mesial palatal, whatever you're headed for. And then this will be a simple suture. Single, single, double. Again, you can see it doesn't really matter as long as you get your knot tied down. The mouth is very forgiving. If this were plastic surgery, you'd be in a whole bunch of issues. But again, you can see how this cross-weaving suture technique does really, really well to keep a clot in. The next thing that I want to show is basically how I do an extraction site for a wisdom tooth. So this is basically how I usually make my incisions for wisdom teeth. I will make it from the distal buccal to the corner of the lingual mesial, and then I will come towards the distal facial of the tooth anterior to the wisdom tooth that I'm extracting. So it basically will make this sort of triangular pattern. And I basically will do the buccal back stitch in that area as well. And I found that that closes up really, really nicely. So again, I'll come from my distal buccal to my distal lingual, and I'll throw my first incision that way. And then I will come to that angle from the lingual of the mesial of that incision, and I will go to the facial of the mesial of that incision, and I'll pull through. But I don't stop there. Because I've made a triangle, now I actually have a bit of a point, and that tells me exactly where my middle point is. So I'm going to come from that midpoint buccal to that midpoint in the lingual. So it's hard to work with. Don't be ashamed to have to pick up the suture. I don't love doing it, but it has to happen. But you go into the midpoint, and you try to get into as much keratinized tissue as possible. And then again, I have made the equivalent of a weaving technique. So then I will throw this suture inside the mouth. Usually this approximates better because I deal mostly with impacted wisdom teeth. And so with the impacted wisdom teeth, you start off with no with a lot more tissue so that they do approximate better. But you can again see that I get a lot of weaving here. And I know this is pretty ugly in terms of how it looks, but I can tell you that as far as suturing goes, this is a great technique that I have found works really, really well. With older patients, I tend to suture just about everything. And if you have multiple teeth that need to be extracted and you're wondering, hey, how am I going to suture this entire arch? I'm going to show you the lazy person's way of doing that. So one of my favorite procedures to do is actually multiple extractions. Full mouth extractions, I usually do at an office that I work at occasionally on the Eastern Shore of Maryland. The Eastern Shore of Maryland is pretty rural. It's pretty underserved, and so a lot of the issues that we see there are just based off of long-term neglect and poor dental knowledge. And so a lot of patients come in for extractions and dentures. And so at that particular office, in order to kind of speed things up, because we see so many patients for so many extractions in a day, sometimes I'll do up to 120 teeth that I extract in a single day. So you can imagine time is of the essence. So basically what I have done is I came up with another suturing technique that allows me to start suturing while my assistant is turning over another room. And that way I don't need her in the room as often to help me cut. And so this is how I do this suturing. So again, I always come from buccal and I go to my lingual and I start on one end. And this is probably the ugliest suture that I do, but it works. So I start pretty close to the very, very end of the wound. And then what I'll do is basically I'll start throwing continuous sutures in the most haphazard fashion. So I'll go in big, big chunks, just like this. So let's say this is the full mandibular arch. I'm going to throw about 4 or 5 of these continuous sutures all across the arch. And even though it seems kind of like a waste of suture, this actually works out to need less suture than the other techniques that I've used. So you can see nice, big, fat, interrupted sutures. And then when I get to this end, this is where I start becoming a neat oral surgeon again. So once I have thrown this last suture from corner to corner, I'm going to go back. So I'm going to basically now do locking continuous sutures. And to do a locking continuous suture, I'll go from buccal to lingual. And then I take my needle holder and I'll come through a loop and I will pull this to me, and I pull it rather tight. So you can see how now I've created again my underwater basket technique, and I will do this all across, heading back towards where I started from. So again, I'll pull through, go through my loop, grab my suture, and now I have done a locking technique. So I will basically do that across the entire rest of the arch, skipping the areas where I did the interrupted. So I go simple interrupted to start off with in big chunks, and then I will do sorry, not simple interrupted, simple continuous right across, and this is locking continuous. So again, come through, pull through, and the name of the game is not necessarily to make pretty stitches. The name of the game is you're trying to make a locking weave pattern so that your patient's arch is going to fully clot. And once the arch fully clots, then you know that they're going to have a pretty good time of healing. So far, so good. I haven't had, even in the hundreds and thousands of teeth that I've extracted at this location, I haven't had any dry sockets. So something's going well. And I gotta say that this technique definitely helps. So I'm going back with my locking technique all the way across, and once I do that, I get all the way across, then I will tie it off back at the same tail that I left for myself. And I will know for sure that I have reapproximated this wound edges. Now, it doesn't look like it here, but what you will see when you actually do this, just to show you the very end. So you get to your very end, and then you get kind of close to your original suture that has the tail, and then you'll make that final locking throw. Trying me. Final interlocking throw. And then you'll just tie it down just like you would a normal sight. So I'll tie it down single, single, double. And I know you've seen me do this 3 different ways. First it was double, single, single, then it was single, double, single, and now single, single, double. But honestly, like I said, it doesn't matter, because one thing that you do want to get done is you just want to have the knot as firmly fixated as possible. So I'll cut this, and like I said, it doesn't look pretty, but that clot is not coming through. So these are basically the ways that I do a suture. I do the buckle back stitch for the molar areas. So that is the throw a suture in the distal, throw a suture in the mesial, and then throw a suture in the central. And then this is what I do for premolars and incisors. I will just go distal and then mesial, throwing across. Okay, and then this is how I do the suture for the wisdom teeth, and it's basically the buckle back suture, but given the triangulated the incision that I've made, it does pull together approximate, unlike it's showing here. And then this is the suture technique, the running buckle back suture, if you will, where I go across with a simple continuous suture, and I come backwards with a continuous locking suture. And so all of that helps to basically guarantee that my clot is going to stay in place, and it really helps with post-op issues. And knock on wood, so far my dry socket rate is less than 0.5% or 0.05%, to be honest. And I hope it stays that way. All right, I hope you learned something, and I hope you have a fabulous rest of your day. Thank you.